Hi, Dr. William Starsiak here, and in this video, I'm demonstrating how we can tighten skin and kill fat in particular parts of the face. So this patient was bothered by her jowls and the loose skin above and below her eyes. So what we're starting off with first is this broad skin tightening. We're using a 1064 nanometer neodymium YAG laser with this scanner here that has this amazing functionality where we can treat a broad area, bring it up to therapeutic temperature to achieve temperature-based skin tightening, and have no variability in temperature. So it's completely even. There's no hot spots that cause pain to the patient. This part literally just feels like pleasant warmth. It's so nice. And we maintain the temperature in the skin for about 10 minutes to get our strongest tightening effect. Here you see me also getting the forehead and her submental region. An area of concern for her is the area under her neck where she has some skin laxity. So this is just the first phase in a series of 4 treatments I'm going to do for this woman. The neodymium YAG is so nice for this purpose because it doesn't resonate with water. So it can penetrate deeper into the tissues and give us some good thermal effect without creating any damage. This can be a standalone treatment. I personally love this one. I feel like it's helped my skin. Now I've applied some numbing cream and I'm using the scanner in a different way. I have a chiller attached to it, so I'm cooling her skin while I'm heating the fat in her jowl area. And this is going to heat it up enough that we start to see fat cell death, and thus we'll be contouring this area. We basically need to heat those fat cells up to about 43 degrees Celsius and hold them there. When this occurs, there is a sensation of internal heat that's quite tolerable. And we maintain it up to the point of tolerability, then move to the other side. This is a fantastic way to kill fat. And we'll be posting her after pictures. She'll need a few treatments with that approach in order to get her to the point that she wants to be. This modality can be used in any part of the body to get rid of fat. Now, I've moved on to another modality with the same wavelength, the 1064 neodymium YAG. This modality is delivering the energy much faster than the previous one. And so it's actually causing small islands of thermal damage in different layers of the skin. And we need to get close to the eye. It's close enough that we'd have to move the glasses anyway. So that's why she's not wearing glasses for this. And I'm just being really careful. I'm going over particular vector lines in the jaw, the cheeks, and under the eye because this is going to help tighten those facial ligaments. Now I'm just cleaning the face off of lidocaine because we had the numbing happening while we were doing those other treatments because the other laser wavelength is fine with having numbing cream on. Now this wavelength is an erbium. It's a 2940 nanometer. So it resonates highly with water and we can use it to ablate tissues, literally vaporize them. Now, what I'm doing here is a fractionated beam where I'm not passing a full beam through to the skin. I'm passing a bunch of dots in a grid. And so what this does is it drills holes down. It fires 6 times quickly and drills down, in this case, about 317 micrometers. And this is deep enough that in many parts of the skin, we've actually gone through the epidermis and we've disrupted the papillary dermis, so we'll see some pinpoint bleeding. This is an excellent way to cause skin tightening, also to resurface for any sort of scarring, whether it be acne scarring, surgical scarring, it doesn't matter. And the healing is faster than if we did a full beam because we're just creating holes down. So it heals around the whole circumference of that hole and creates this just awesome tightening. The really cool thing about this modality is we can treat right over the eyelids. It's not going to damage the eye at all. So this gives us a great ability to tighten the skin there. We can also use these fractionated treatments to deliver topicals more deeply, like exosomes or PRP. And you see I'm using the hose there. That's the chiller. That makes the treatment even more tolerable. Now I'm going to finish up the areas under the chin and then get into doing a second pass on areas of concern for her. So that is the eyelids and the region above the eyelids and below the eyelids. So you can see that I'm going all the way up. I went all the way up to the forehead on both sides. That's going to help with lifting from there. So just getting double passes there. And then also the laxity of the skin under her neck was another one. So I went over that twice. And we have fresh aloe in the clinic. So this is aloe I cut fresh for this purpose. It's very soothing. It speeds healing. It modulates inflammation. It's fantastic. And it's antibacterial. It just feels really good as well. Gets the skin wet. And then I put the chiller to dry the aloe and cool the skin down even more. And it just feels very pleasant after the treatment because there's going to be a little bit of burning sensation after treatment. I also apply another barrier ointment that has some pain reducing properties to it, which is pretty nice. And then it'll take her about a week to fully heal from this and to begin to see her results. And I'll show you those when they come in. Thanks for watching our video.